kind of treatment that you and your group have brought out. It is really cutting edge. Regenerative cornea in the form of, the whole concept of the limbal stem cells.
He explained to me how the ophthalmology is fascinating for the next 20, 30 years.
Was a cornea as a specialty at that time in 70s when you went there?
In 60s, there's still not much of the knowledge of the corneal endothelial.
When you joined the Retina Foundation, did you join as a fellow or a researcher, or there was no fellowship at that time?
As a research fellow, but at that time, because he was the assistant professor.
Japan, America, just a few years or 20 years after the Second World War, what was the political situation like?
Every presentation that I have heard was new.
Oh, okay.
Novel.
When you were studying in Harvard, did you have a doubt that I should go back to Japan or should not, or stay back?
I really want to go back to Japan.
Did you encounter any challenges starting in Kyoto?
I performed almost every surgery, including a retinal surgery or the glaucoma surgery or strabismus surgery.
Good morning. My name is Dr. Virender Sangwan. I am with the very distinguished professor from Japan, Professor Kinoshita, who has been a mentor, teacher, and a great friend for me. And such a proud privilege, Professor, today to interact with you, talk to about the development and the history of cornea as a specialty. And I know that you have been there in the field for more than 50 years and you have seen it all. So I like to really learn and share with you, for the audience, for the young surgeons to take inspiration from how our cornea specialty has developed. So can you please, introduce yourself a little bit and then we'll go further.
Well, I think the Professor Virender Sangwan, thank you so much for the very kind invitation. You are a very good friend of mine, and also you've been working in the field of the ocular surface and to develop so many good things for the patient. And I tried to do so also from the beginning of my residency program. I was graduated from Osaka University Medical School in 1974. It's about 50 years ago, I think 51 years ago. And then after the residency program, I spent some time in Japan, in Osaka, and then I had a chance to go to the Boston at joining the at that time Retina Foundation we called it's an affiliation institute of the Harvard Medical School, and the spending 3 years over there and coming back to Osaka. And I think from the 1992, I got some of the position at the Kyoto Prefecture University of Medicine in Kyoto. Yeah. It's about 1 hour from Osaka. And then we actually made a reasonably good, I would say, the department of the ophthalmology.
Well, we are very humble.
I think we tried to make a new treatment new treatment for the various kinds of the diseases, including cornea. So why I'm so much interested in that kind of things? At the time started in my residency program, my professor, mentor, Reizo Manabe, he was also the kind of a student of the Cross Dolman, and he spent just over the 3 years in Boston many years ago, and he tried to fix some of the corneal diseases such as Moran's corneal ulcer and Stevens-Johnson syndrome and chemical injury. And as a residency, I was an assistant of the surgery as well as the inpatient, and then I knew at that time, even though he was a very skillful surgeon, he tried to do by his best to the patient, but within months or 2 months, 3 months post-operative, these patients didn't get a good situation, or maybe worse. So I thought at that time, even though you become the very skillful corneal surgeons, and that didn't mean that you could treat properly the patient. So we really have to understand something. At that time, I think the beginning of the cellular biology. So so I think that the simple is best. To me, the simple is best, and then whatever the reason that if the some of the treatment and whether that is novel or not novel, I think new treatment, if that is effective, I think we should apply for the patient. So I think I started from the chemical injury.
Thank you. I will come back to you again. So let me, highlight for my audience the kind of treatment that you and your group have brought out. It is really cutting edge, regenerative cornea in the form of, the whole concept of the limbal stem cells, then cultivated limbal epithelial transplant, cultured endothelial cell injection, then COMET. But I'm more interested, how and why did you choose cornea, and what made you to go to Boston? As a young boy, please tell me so that my audience can correlate when they are choosing the specialty.
I see. I think initially as a medical student, I thought I'd like to join the cardiovascular department, but 2 years senior to me, that is the Professor Yasuo Tano. Yasuo Tano is a very famous retina surgeon, but at that time, he's 2 years senior to me. He actually recruited me to become the ophthalmologist, eye doctor department. I don't know how, but he explained to me how the ophthalmology is fascinating for the next 20, 30 years or so. So, and then I changed completely my mind in ophthalmology. And then when I joined the ophthalmology, he already picked up the posterior part of the eye. I will become the big retina surgeon. So he said to me, "Why don't you go to the anterior part?" So simple. That's a simple way.
Okay.
Yes.
Tell me a little bit about when you landed up in Boston. What was the overall country like? Was a cornea as a specialty at that time in 70s when you went there? Or it was just like Dr. Klaus Dolman and Richard Hoft and these people, or what was the environment like? Who were the key players?
Well, I think the Crows made enormous, I think, not only for the department, the group of the corneal, at that time I would say corneal research. So I think they established for instance, Boston Corneal Conference in the 1962, something like that, near the Andover area.
I was not even born at that time.
Yeah, I see. Okay. So every 2 years, they are discussing about the corneal, the research, because I think in 1960s, there's still not much of the knowledge of the corneal endothelial cell, they have a pump function, or why the corneal stroma is so transparent, or there's no knowledge about the difference of the corneal epithelial cell and the conjunctival epithelial cell, something like that. That's a just really beginning point. So they are discussing about such kind of a corneal research, and then. When I joined at the Retina Foundation, corneal department at the Retina Foundation, it sounds funny, right?
Funny, yes.
And I think Richard Thoft was at that time 40 years of age, assistant professor. But he wrote a very nice paper in Archive Ophthalmology in 1977. That is autologous conjunctival transplantation to the patient with a chemical injury. So I was so impressed by that paper. So I thought I really want to go with them to learn something. So that's the beginning point.
Okay.
That's the beginning point.
So when you were when you joined the Retina Foundation, did you join as a fellow or a researcher, or there was no fellowship at that time?
Well, I think as a research fellow. As a research fellow, but at that time, because he was the assistant professor, he doesn't have much of the money to support the fellows or the research fellow. So therefore, I said to him, "That's okay for the 1 year. 1 year, I will keep. I will spend my money to go over there." So at that time, I think U.S. Dollar and yen ratio is not like this at about over 300 yen, something like that. But I asked my mother to give me the money. So that's a starting point.
Yes. So can you tell who was the Cornea fellowship design? Who did? Is it Klaus Dolben, Richard Thoft?
Oh, I think that's a Richard Thoft, because I belong to his group. But they only have a two-person, Judy Thoft and also Timothy Kiopis. Timothy Kiopis was graduated from the MIT. He's a very genius person, and he's specializing the vitamin A pathways.
All right. But I noticed that means your early exposure to limbal stem cell deficiency, maybe it was not known, like chemical burn, because now you have developed so important treatment, which all of us are following.
Well, so I think that was a very funny story. At first year, the Dexhoff asked me to see the fate of the donor corneal epithelial cells. So I would say not many, I would say several, the fellows, clinical fellows, they tried to prove the presence or the absence of the donor corneal epithelial cells after the allogenic transplantation in rabbits or whatever. And they failed. So therefore, I thought I received the same subject. So I think if I do the same thing, and I will fail. So therefore, I made a bit different, I think, system to see that actually the culture that some of the corneal epithelial cells for just a week or so, and to see whether this shows the positive or negative sex chromatin, something like that. And then sex disparity of the rabbits, and I used that. And then I saw some of the diffusion of the donor corneal epithelial cells with time. So that is an unexpected experience. I think it's okay. But then the second year, I had some of the a bit different experiment to see whether the basement membrane of the corneal epithelial cell is very important for the differentiation process. And then I wrote the abstract for the second year of the ARBO meeting. But 1 month before that meeting, I realized my concept of the theory, and the result is the same, but the concept was wrong. I understand that. So and then I asked the Dick Soft, and Dick said, forget about the abstract and whatever you found it right. So talk them.
All right.
So I think that is very, very, I think, inspirational to me. So well, we try to do our best to show them what the reality is, and that could somehow going to the story of the importance of the limbal stem cells.
Yes. So now tell me little bit about, at that time, Japan, America, just a few years or 20 years after the Second World War, what was the political situation like?
Well, I think a political situation I didn't understand at all, but at least in ophthalmologically, we are far behind.
All right.
We are far behind because in 1978, in Japan, in Kyoto, we had a International Congress of Ophthalmology that was held in Kyoto, and there are very distinguished the clinicians, speakers, all coming from all over the world. And as a just finishing the residency program, every presentation that I have heard was new.
Oh, okay.
Novel. And so therefore, I was so astonished about our situation.
So did you have any doubt when you were studying in Harvard? Did you have a doubt that I should go back to Japan or should not, or stay back? Or you were always very clear that you want to go back to Kyoto and do your, contribute to your country's?
I think, well, for instance, almost 3 years when I spent, Dick I think moved to the Pittsburgh, University of Pittsburgh, and then he asked me to go with him. But I thought as a medical doctor, and I really want to go back to Japan. So I think most of the Japanese, that is funny, because the Korean doctors or some of the Asian doctors, Chinese doctors, they may stay in the United States.
Yes,
but I think almost 100% the Japanese doctors go back to Japan.
Okay. Were you married at that time?
Yes. I have 2 children at that time also.
Oh, so your wife was okay to come back. She didn't want to stay back?
Well, I think they'll have to stay in Japan. So
very nice. So can you please tell me, when you came back in Kyoto and you're a young doctor now starting your career, did you encounter any challenges starting in Kyoto, and your vision? When I see today the accomplishments you have contributed to the cornea and cornea field in terms of developing the department, mentoring next generation leaders, developing new technologies, is phenomenal. So I'm sure there must have been challenges. Do you remember any big challenge in the early years?
Well, I think when I come back from the United States, and I spent several years at the affiliated hospital at Osaka University Medical School, and then I performed almost every surgery, including a retinal surgery or the glaucoma surgery or strabismus surgeries and the corneal surgeries. But at that time, I'm mainly focusing on chemical injury and Moran's ulcer treatment in a corneal field. So, and then I have found some of the surgical procedure called keratoepithelioplasty that is effective in Moran's ulcer. So that's to me very I think good for me, because once I presented, and at that time nobody really treat properly of the Moran's ulcer. So, and one professor from the Nagoya University and one professor from Tokyo University, they send these patients to me at the local hospital from the Tokyo or the Nagoya University, and then that was to me very honor and then I really have to treat them properly. So and then that was successful. So that's my reward.
So do you think now the treatment of Moran's ulcer and all that is developed, or do you think there are still areas that we need to work, or the next young generation need to think about?
Yes. And because the number of the Moran's ulcer is decreasing, but and also immunosuppressive agent is now available. But at that time, there's no immunosuppressive. There's only the steroid eye drops is available. So I think, but still, there are some of the space to do that. So,
All right.
So that's what I thought.
So I see that you have started working very early on the cultivated limbal epithelial transplant, then cultured endothelial. How did you get these ideas?
Well,
And what motivated to work on such cutting edge technologies?
I think that was in 1997. Graziella Pellegrini published the one paper in the Lancet. But I think I cultured the corneal epithelial cells and published the one paper in the 1982 or so in IOVS, and that is the corneal stroma carrier and the cultured epithelial. So that's a very simple, but that is not worthwhile for the clinical setting. I understand that. But and then Graziella published a very nice paper, although that is autologous. So I thought when I read it, I thought that is worthwhile to try it. So I asked the Noriko Koizumi and then to try to make this project. So that's about the early 1998 or so, and we published one paper in the year 2000 or 2001.
Yeah, I think you published in the New England Journal of Medicine.
No. That was Reisai.
Reisai. From Taiwan.
Yeah, from Taiwan. Okay. Yeah. So I think that was great. That was great, and we understand the importance of the location of the limbal stem cells. So I think there are many ways to do it.
Yeah, but for staying at the limbal stem cell, since you have been at the place where these work happened early in 70s in Boston. Can you tell me a little bit about Graziella Pellegrini and her husband and Howard Green in Mass Journal? What their link up, or was he doing keratinocyte culture or something?
I think the Howard Green has a very distinguished, three students. One is DeLuca.
DeLuca, her husband.
And the other is Fiona Watts in England, and one is Jan Balandon in the Switzerland, France and Switzerland. And then the DeLuca and the Graziella developed the very a genius way of the cultured epithelial cell sheet using the kind of 3T3 cell support of that. So that system is quite, I would say, was effective, and they modified the procedures.
So now I see that when I visited you last in January, and we went through the endothelial cell culture, and the Japanese government and this company Orion is doing good work in bringing that treatment to the clinics.
Sure.
And yesterday you told me that even the Alcon has purchased this Orion company. So tell me, what was your motivation to get into endothelial culture?
Well, I think
what was the motivation at that time?
Well, I think when I came back to Japan, it's the 1982. At that time, specular microscope, that was contact specular microscope, was just released from the several companies, but mainly the Japanese company. And Conan released the prototype, and then also the first generation of the specular microscope that was released. That we at the Osaka University purchased the second instrument of that.
that.
So I thought that I really want to work in the field of the corneal endothelial cell. But my the young faculty members, Mamoru Matsuda, he's already passed away, but he is also very hardworking, genius person, and he said he really want to work in this field. So I think why not? Why not doing that? So I will partially support that. So and he's working very hard, and also after that he went to the lab of the Henry Hank Edelhausen. So something like that. So about 20 years later, when I talked with Nancy Joyce, and Nancy Joyce said to me, "I'm retiring very soon." So I thought, you retire. So in this case, I think the endothelial cell biology, this field will be gone from the ophthalmology. It's more like a Harvard simplex bias, I think, some of the research.
Correct.
So therefore, I think somebody at least has to join this the cell biology type research in endothelial cells. So that's why I said to her, and then I send one person, that's Yutaka Ishino, to her laboratory, and also there are several the doctors.
Now, I think Noriko was working on this.
Noriko was working, but that is later.
Later. Oh, much later.
Yeah, so something like that. But I think at least in Japan, the Tokyo University group, they are also very much interested in the culture of that.
So staying on the endothelium, and you have been associated and actively worked on endothelial. Do you think we know enough about endothelial cell biology for the cornea, or do you think that young doctors, some of them should take up active interest in developing this field further?
Well, there are many things we have to do. There are many things we have to do. Yeah, because the clinically, I think cultured endothelial cell is available at least in Japan, and then in the US they have ongoing clinical trials. But that's a first generation. That is, I would say, acceptable, or is okay, or there's something like a perfect. It's more like OCT. Started from a time domain OCT to SSOCT, something like that. So I think there are a lot of improvement we have to do. Yeah. I think as a scientist,
so cell biology, you think that there is a need to understand and work more.
So, for instance, we know the standard cell biology, but for instance, microRNA or the vesicles, we do not know anything about some of the interactions of that.
So now, how do you spend your time? How do you? I see that you are still very active, and when I saw you in Kyoto, that your group is very active. Chi Sotozono, all your people have a very high regard, and they are following things that which you have set up. Do you feel good and satisfied on what you have done so far?
Well, I think the Chie Sotozono, she is my successor of the Department of Ophthalmology, Kyoto Prefecture University of Medicine. She has done a wonderful job to organize the not only for the cornea, glaucoma, the retina, or plastic surgery, or something like optics, something like that. But so to me, I'm working with the two PhDs and then a kind of a small group and focusing on the 2 or 3 projects. One is corneal endothelial cells, one is meibomian gland dysfunction, and one is a kind of Stevens-Johnson syndrome, but that is Mayumi Ueda is in charge.
All right. So now we go back to the history of cornea service and early 70s. Who were your contemporary who are still active and working? I know Dr. G.N. Rao from India, L.V. Prasad founder. He was in Rochester and he was also in Boston. Who else is that you can think of, your contemporary at that time,
Well, I think 1970 or 1980s, but I think of course, the Steve Fruchtfelder.
Yes, to
The
Flufelder,
Steve
yes, very well.
Fruchtfelder is been working in the field of the dry eye, and then he has a good idea about AI as well as some of the pharmaceuticals as well, and then
Professor Subota,
yeah, Kazuo is very much interested, but he was going to the business part.
Business
So
part.
he made the corporation,
Okay.
and that was on the stock market. So he's so busy about that.
And what about Sefer Singh was
Jefferson also made his corporation of the amniotic membrane.
membrane,
He's been working very hard about the research as well, but not much in the field of the corneal field as well. But Betty Finney is working about clustering the project, and so Jim Jester is working the Marbumian grant. So there are several. They're working very hard.
good?
So,
Good. So Dr. Rao was your contemporary.
I think Dr.
Jim Rao
Rao
must
is
have
a
come after you.
no. Dr. Rao is a bit, I think, senior, or he spent so many years in the U.S., right?
Yes, yes.
So he knows more than I do.
Okay.
So I only know some of the Boston area in the U.S.
So now for younger doctors, I would ask you that if you have to say something, that how they should organize their professional life, what should they focus on, what would be your advice?
Well, I think that there are many ways to think about your life itself, but to become the medical doctor, what's that mean? So I think, at least I'm a Japanese, so there are so many economical or financial or the money issues. It's going around in a worldwide basis, not only for the medicine, but as a being the medical doctor. So I think as long as the patient, especially the very difficult to treat, these patients, if you encounter and then if you could do something for that patient and properly treated, they are so happy about meeting you and me or something like that. So I think that is reward for us.
Oh, yes, yes.
Yeah.
What do you think about the kind of work that we are doing along with startup like Pandorum, the liquid cornea, exosome based things? What do you think that this technology can do?
Well, I think always I try to write some of the cartoon in the near future. So once we could make some of the cartoon, that will make the real. So I think, for instance, we have different kinds of antibiotics or the steroids or whatever. So that is already very established, but that was already past. So when we're thinking of the new or the future, some of the treatment, 10 years or 20 years from now, I think definitely we have to find out the new type of the not only for the molecules. I think it's a kind of a combination of the drugs. So at that time, to me, exosome is one of the promising one. So that's why I'm very much interested in that.
So thank you very much for this part, and I would now just spend a minute about you being so generous and kind to me for writing the foreword and praise for the book, The Unbound. And I just want to sort of get your feedback about Anil has presented you the book.
Sure, sure.
Have you been able to read or
Not 100%. Not 100%.
but I'm sure you will find it. It essentially talks about maybe my journey, but how to solve the problems of our patients, how to bring new technologies. So I'm sure that it will help inspire people not only in our country and in Japan and all over the world.
I see.
And I really appreciate your gesture of writing a few words for the book and for always supporting me. Thank you very much.
Well, I think this is fascinating. I think usually you have to do so many things, but you have already not summarize. I think make your soul outside.
Yes, thank you very much.
I think that was fascinating.
Yes.
Yes.
Thank you, sir. Thank you very much.
you.
Thank you
Thank
very
you.
much. Thank you. Thank you.